Hello, my name is Frank McStay and I'm a Senior Policy Analyst with the Baylor Scott and White Health Center for Healthcare Policy. My co-authors and I paper, Diagnostic Accuracy in Primary Care E-Visits, an evaluation of a large integrated delivery health system experience, is appearing in the forthcoming issue of Mayo Clinic Proceedings. Our paper focuses on e-visits. It's a modality of telemedicine that leverages asynchronous and synchronous technologies functioning like an adaptive interview. In 2015, our system began to pilot e-visits in the primary care service line to diagnose low acuity illnesses like UTI, URI, conjunctivitis, and others. The purpose of our article is to provide a summary of our results and outcomes to date, whereby we find patients receiving a diagnosis through our e-visit web portal are just as likely to receive a correct diagnosis as those face-to-face with the clinician in our outpatient clinics. Our primary outcome of interest was to determine whether the proportion of patients who receive a revised diagnosis 10 days after their initial encounter, as determined by a medical chart review and a change in their ICD-10 code, is different for face-to-face than it is for e-visit patients. We did not find a difference between our two populations. Specifically, depending on how we ran the data through the model, we find that between 2.5 and 5% of patients receive a revised diagnosis, regardless of whether it's an e-visit or a face-to-face patient. The implications for our finding, bearing in mind its limitations, are that both clinicians and patients should have confidence in the e-visit modality of care. Patients can receive effective primary care in settings that are convenient for them, and clinicians can safely and accurately diagnose these low acuity illnesses through e-visits. However, as both Baylor Scott and White and the medical community continue to proliferate e-visit models, more studies are needed. This is especially true in regards to antibiotic stewardship and practice economics, when we begin to look at whether these cares shift demand from inappropriate settings to more appropriate, cost-effective settings. Thank you, and I hope you enjoy the article.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.